Okay, today we are going to do an assessment on the skin, hair, and nails. This is my co-worker, Kendall. Kendall, is it okay if I record you, upload this video to YouTube, and receive a grade for it?
It is.
Okay, thank you. I'm going to begin by introducing the skin, hair, and nails. The skin is the largest organ in the body, and it is important because it helps protect from trauma, pathogens, and dirt. It adapts to environmental influences such as temperature, seasons, pollution, etc. The skin is composed of 3 layers, the outer layer being the epidermis, the second layer is the dermis, and the third layer is the subcutaneous layer. The skin is waterproof and almost indestructible. It has various functions that are very important. The first is protection. It helps protect the body from physical, chemical, and thermal injuries. It also acts as a barrier. It prevents microorganisms from entering the body, and it prevents water and electrolyte loss. It also functions for sensory perception. It allows us to sense touch, pain, temperature, and pressure. It also helps regulate temperature. For example, if it's cold outside, we'll begin to shiver, and if it's hot, we'll begin to sweat. The skin is also very important with wound repair and vitamin D production. The hair is no longer needed for protection against cold or trauma, according to our textbook. However, it is still very important in various cultures due to its cosmetic and physiological needs. The hair is made up of keratin. The hair shaft is the visible part, and the root is embedded in the follicle. Hair growth is cyclical with active and resting phases, and they are independent. So while one follicle is active, the other one may be resting. There are 2 types of hair. The first type is the fine, faint, vellus hair, which covers most of the body except for our palms, soles of our feet, mucous membranes, inner labia, and the shaft of the penis. And the second type of hair is the terminal hair, which is the dark, thick hair that we have on our scalp and eyebrows. After puberty, it is found in the axilla, pubic area, and in men, they'll begin to have a mustache and a beard. The hair is important because it gives us information on, it's important with conditions that are significant because it helps diagnose and treat certain diseases. For example, if a person does not have ideal nutrition, their hair may start to become dry and brittle. In African American children who are malnourished, their hair will be less kinky and it will take on a reddish, copperish look. The nails are hard pellets that are composed of keratin. They can be found on our fingers and our toes. The nail plate is clear with longitudinal ridges that become more prominent as the patient ages. The nail takes its pink color from the underlying nail bed, which is highly vascular with epithelial cells. The cuticle covers and protects the nail matrix. Nail changes may be seen with systemic disorders such as malnutrition, inadequate circulation, or with local irritation such as nail biting. When someone is completing an assessment, it is important not to miss or omit anything because the skin can tell you lots of things such as circulation, nutritional status, and signs of systemic diseases. Skills that will be used today are inspection, palpation, and even smell, because if a person has a wound or an ulcer or is not clean, you will be able to smell that. Ideally, the patient should remove all his or her clothes, jewelry, nail enamel, artificial nails, wigs, and hair pieces, but today Kendall will stay fully clothed. I will start by asking her some questions about her status. So, Kendall, tell me about any problems that you've had in the past with your skin.
I've not noticed any problems in the past.
Okay. Tell me about any changes in your skin color or pigmentation.
I've not noticed any changes.
Okay. Have you had any changes in any mole you may have? For example, a change in color, size, shape, or the sudden appearance of any mole?
I have a lot of moles, but they've always been there. I haven't noticed any new ones or any changes to the ones I have.
Okay. Describe any tattoos or piercings you may have and where they are located.
I have 3 tattoos, one on my right leg, one on my left ankle, and one on my left shoulder.
Okay. Were they placed by a professional using sterile equipment?
Yes.
Okay, that is good because you know the risk of hepatitis is always there.
Mm-hmm.
Do you tan?
No.
Do you wear sunscreen?
No.
You don't. Okay. Have you noticed any changes in the feel of your skin, for example, moisture, texture, or temperature?
No, it's dry, but I've not like noticed any difference in the temperature of it.
Okay. Where is the dryness?
Kind of all over, just in the itches.
Okay. When did it start?
I noticed it it started in the winter.
Okay, in the winter. What do you do to make it feel better, and does it work?
I use lotion, but it doesn't always help.
Okay. Describe any skin rash or lesion that you may have.
I don't have any.
Oh, okay. Are you taking any medications?
No, I don't. I'm not taking any medicine.
Are you taking any vitamins?
Oh yeah, I do take a multivitamin.
Okay, that's good. What is your daily grooming routine?
I shower in the morning, and then in the evening, where I'm just so tired, I love taking a bath.
Okay. Do you use lotion afterwards?
Not always.
Not always. Okay. What do you do to your hair?
I wash it every day. I blow dry it, and then I flat iron it.
Is that an everyday thing?
Pretty much.
Okay. Tell me about any changes with your hair.
It tends to be dry some too.
Okay. What is your diet like?
I probably don't eat like I should. I eat a lot of fast food. I know I need more fruits and vegetables though.
Okay. What fluids do you take in fluids?
I like tea.
What about?
I know I need water.
Okay. And do you perform a skin self-examination?
I look, but not too much.
Okay. Okay. Well, I'm going to begin with your assessment, okay? Okay, so I will begin by looking at her hair. She has black, it's thick hair. There's no signs of infestations, no dandruff. There are no lesions. The hair is thick and short. It is dry. Her eyebrows are there. I can tell that. Do you pluck your eyebrows or wax them?
I get them waxed.
Okay, okay. She does have, I'll stand back, and her complexion is smooth. I can tell that it's darker where the sun hits. I'm going to look at her ears, make sure there's no lesions or moles around the ears because skin cancer can be seen there. Skin is warm bilaterally. Do you mind laying back for a little bit? Out. I'll check for skin turgor. It rises good and it goes back down easily. Okay, I'll sit you back up. There's no evidence of any lesions on her arms. Vellus hair is there. There's no signs of balding. I'm looking at her fingernails. The matrix is intact. The cuticle is intact, excuse me. They're nice and pink. Very good capillary refill. Bilaterally. Edges are smooth. The nail plate is firmly attached. They are well manicured. No nail ridges. So those look good. And the angle is 160 degrees, which is what is expected. Do you mind pulling up your pants? Okay, and I'll do the other one for you. Here you go. Okay, legs are nice and warm. No signs of swelling, no edema. I can tell, do you shave your legs?
Yes.
Okay, I can tell that you shave your legs, although I don't see any signs of hair loss. Are you able to sense pain or anything like that? Okay. Her feet are nice and warm. They are cooler than the rest of the body, but that's expected with circulation. Her feet, her nails are well manicured. They are cut good. Cuticle is intact. I'll look between her toes. That's nice and smooth. No signs of fungus or cracks. And ideally, if she were to be undressed, I'd ask for her to lift her breast. I check under the breast, make sure there's no moisture, lesions, yeast, or sores, and I'd also check under any skin folds. Nursing diagnosis for Kendall would be readiness for enhanced nutrition, as evidenced by the patient stating that she needed to increase her fruits and vegetables. A second nursing diagnosis for her would be readiness for enhanced health maintenance, as evidenced by her saying that she does check her skin, but we may want to include a skin self-examination brochure so she can do a full body. Some of her weaknesses are that her nutrition is not ideal because she eats out a lot and she needs to increase her water intake. She does have dry skin and her hair is dull. The good things that she does is that she's clean and well groomed, her skin is intact, and she takes a multivitamin. We would encourage her to increase her water intake, possibly take less baths, and choose to take a shower instead because baths usually do dry her out, and make sure she puts on lotion afterwards. We would also encourage her to use sunscreen and to decrease the trauma to her hair. For example, maybe not wash it every day or flat iron it every day, but every other day. And we would also encourage her to perform a self-skin examination at least once a month. So that concludes my video. Thank you, Kendall.
Thank you.
Push pause.